Beyond Hospital Doors, the Asthma Project with the American Lung Association on the front lines of asthma care. Sidney Regional Medical Center presents a new podcast series. We are taking our signature health and wellness profile and breaking it down into episodes where we will speak with our providers and top experts on issues that extend beyond hospital doors. This podcast, we feature Ms. Kristin Narjes, the Director of Cardiopulmonary Services, and Ms. Shirley Wilson, our staff asthma champion and respiratory therapist, on the topic of the Asthma Project with the American Lung Association on the front lines of asthma care. Join us as we go beyond hospital doors, as I will be your host. This is Kimberly Dreyer. Ladies, welcome, and let's get to it.
Thank you.
Thank you.
You know, not too long ago, Ms. Julie Schlegel, Vice President of Patient Care Services here at Sidney Regional Medical Center, sent out a descriptive, well-written letter to our team of professionals regarding the new partnership with the American Lung Association. Quite outstanding, I must say. Mm-hmm. And in part of her letter, I'm going to read to you what she wrote, and this is just a part of this fantastic letter. She writes, COPD and chronic lower respiratory disease ranks as fourth leading cause of death to Nebraskans, following cancer, heart disease, and COVID-19 in 2020. The death rate is 43.4 out of 100,000, with 1,061 deaths in 2020, being attributed to chronic respiratory illness. Nebraska ranks 15th in the nation in death related to respiratory illnesses. Amazing. Sidney Regional Medical Center agreed to partner with the American Lung Association in July 2022 to inspire the launch of the Enhancing Asthma Care program. Currently, Sidney Regional Medical Center Medical Clinic, along with our physician champion, Dr. Matthews, we are the only clinic to do this in Nebraska.
That's right.
That's right.
That is amazing. Kristin, please tell our listeners about this partnership and what it means to Sidney Regional Medical Center and to Nebraska.
Well, as you mentioned, we are going to be the first hospital and clinic in the state of Nebraska to form this partnership with the American Lung Association. And it is just an amazing thing that we are able to offer to our patients. What this does is the American Lung Association will give us tools to help identify, diagnose, and treat our chronic respiratory patients here in Western Nebraska. Now, this is an asthma project that we are currently working on with the American Lung Association, but this will also reach out to our COPD population, our emphysema population, our interstitial lung populations.
Absolutely.
So this program is going to touch the lives of so many people in Western Nebraska, Northeastern Colorado, and Eastern Wyoming, because we serve a large area here at Sidney Regional Medical Center. So along with this, like I said, it helps us to identify, diagnose, and treat. And the American Lung Association gives us like asthma pathways for our physicians and our staff to follow. And along with these pathways, it helps get all of our patients on the correct medications, how to manage their symptoms, and like I said, the pathway to go down the correct path of maintaining their health.
That is amazing.
Yes, to improve their health and their lives.
That is amazing. This nationally recognized quality improvement partnership has been proven successful with now more than 450 clinics in 15 states.
That's right.
Man, is there specific certification in this program? Shirley, what is the asthma educator certification? And that's what you have now, or
I'm going to sit for it soon. An asthma educator, a certified asthma educator, is a person who tests out, and they have to learn a whole lot about asthma and about all the medications that people take, all the diagnostic procedures to diagnose them with asthma, and be able to create a clinic and work in that clinic and treat patients. Education is really, really big. And you test for that, and then if you pass it, you become a certified asthma educator. There is a lot of education that you have to go through for that. You can take, the ERC is talking a lot about that. The MBRC now has taken the certification testing over, which is National Board for Respiratory Care. And it's a way to grow as a therapist or anyone who's interested in the care of an asthma patient.
Kristin, our cardiopulmonary team will be opening a new service in January 2023. Rehabilitation in collaboration with the Asthma Project. A new service in 2023, what does that mean?
So the new service that we are looking to open is pulmonary rehab. So in pulmonary rehab, we have respiratory therapists. Shannon Messagadis is heading this up for respiratory therapy, along with our other rehab staff, which we have two RNs, Kayla and Lucinda. And we will be working with the patients who have been identified through this American Lung Association program. So you have to be diagnosed with these chronic lung diseases to attend pulmonary rehab. And in pulmonary rehab, again, it's helping these patients understand what their triggers are, maintaining their health, and reaping the benefits of building up their endurance and their stamina to live stronger, better lives.
I'm more confident.
And so the asthma program, like I said, also helps us identify the patients that would benefit from the new pulmonary rehab program.
That's nicely said.
You know, as you touched on a little bit about the triggers, I was most amazed at some of the things that do trigger asthma, and they are air pollution, allergens, sometimes exercise and stress,
Yes,
certain chemicals in the workplace,
absolutely.
causes the airways of the lungs to narrow or become blocked, making it hard to breathe. And what other things can cause a trigger?
A big thing with inner city, especially with children, cockroach droppings is one of the biggest things that people, their children especially, are sick all the time. The poor people that are disadvantaged and they're living in environments where they have those kind of bugs. Mold is a really big deal. And dust and occupations also. For instance, a person who works at the Mint where they cut money, they will get into, there's a dust and they'll have asthma the whole time they're working that week, and then when they go home on the weekend, they're well. And in the South, there are a lot of textile companies. They're making cotton fabrics and things like that, and there's stuff called brown lung, black lung for miners, all this kind of stuff. People who work toll booths, the way they used to have big toll booths, and they would have the carbon monoxide, and they're sick all the time, and they would retire young. They would be disabled.
And out here in western Nebraska, you kind of touched base on it about the environmental triggers. We have a lot of farmers or people that work outdoors here in western Nebraska, and being around the dust and the chemicals that the farmers use and all kinds of things. And you think about the fertilizer plants, how many people are employed around all these different chemicals that are irritants to your lungs. And you also forget, like, in people's homes, pet dander is big. There's a lot of triggers within the home, smoking, which we know about that. But there's a lot of things that trigger people's, not just asthma, but respiratory issues overall, that most people don't think about. And if we can identify what is causing those and what those triggers are, we can help treat these patients.
Amen to that. So I want to go a little bit into a plan of care. Management and health maintenance of people with chronic respiratory disease who remain symptomatic. What is the goal for the Asthma Project?
Well, our goal is to educate the staff that's running the clinics and nurses out in med-surg in those areas, everyone that works here that provides patient care, that what triggers asthma, the medications that we would use, what's important, how to identify there are levels of asthma severity, and then there are ways to treat that with asthma action plans, big time education with everybody, and then we can disseminate that education to our patients so they can control what's going on with them.
Thank you, Shirley. Let's talk about the American Lung Association, as we are excited for the improvements and the advancements in care that it will bring to Western Nebraska and to our patients and surrounding areas. Let's talk about engaging the clinic team. How does that work?
Well, Shirley kind of touched base on this a little. So, as you mentioned at the beginning of the podcast, we have a physician champion, and that's Dr. Matthews. And we also have a mid-level provider champion, and that is Nicole Linton, PAC. And so, along with them and the respiratory therapy staff we have here at Sidney Regional Medical Center, we've invited our clinic pharmacist, which is Michelle Mildenberger, and clinic nurses to be a part of this team, as well as our acute care nurses and our ER nurses, because we all work together to care for these patients in one way or another. And through the American Lung Association, we received this asthma education, which is online courses that our staff can take. There's also education materials for patients that we can direct them to on the American Lung Association site.
That's right.
The Asthma Educator Institute, which Shirley had touched base on, as well as like a COPD educator, smoking cessation classes, a whole bunch of education avenues through the American Lung Association. And we do a baseline assessment, which is the first steps in identifying these patients. And through the ALA, we are taught what this baseline assessment is. It helps us, again, to identify these patients, diagnose these patients, and we do this through simple testing of spirometry or pulmonary function testing to get them on the right pathway to control their symptoms.
Amazing. You know, when I was doing some research and talking with you guys before we even began this podcast, I was amazed at the emotional content of someone, of what they might go through, and found that there is, enlightening so, a certain amount of anxiety and depression associated not only with asthma but COPD and upper respiratory. Can you talk about enhanced endurance and managing the asthma and how to help reduce stress?
Well, so many people really get down if they're ill and they feel like they're just not getting better, and it's up and down all the time with their health. And if we can help people better manage their illnesses, especially with asthma, then they have brighter days. They feel stronger, they feel empowered, and they have autonomy in their lives. Their lives are not broken or having uncertainty about, am I going to be sick today? Or if we go do this, is this going to happen again? They are strong and able and being able to take care of themselves. Their personal relationships benefit from it. They can go to work. Their finances are more stable. All this kind of stuff is a big deal, making a person feel healthy and well and whole and productive. And that's all that we want for anyone that comes in our hospital.
Thank you, Shirley.
You're welcome.
November 2nd and 3rd, 2022, the American Lung Association will be on site here
yes.
at Sidney Regional Medical Center. Talk to our listeners about the visit and the training that is offered.
Absolutely. So we are so fortunate to have them come here to Sidney, Nebraska to give us this one-on-one training. And it will not only be given to the SRMC staff and providers, we're also opening it up to the Western Nebraska hospitals and clinics. Invitations are going to be sent out to them, letting them know about our in-person on-site trainings with these professionals from American Lung Association. And as I mentioned, there will be specific provider training that will be our doctors, nurse practitioners, and PAs that will attend to, again, help them identify these patients and how best to treat them and introduce them to the action plans that we'll be coming up with. And then there will be the staff training, so our respiratory therapists, the nurses, all these people that are involved in the patient care, so that when we see patients come in our doors, we know to alert the providers, hey, I see this stuff happening, maybe we need to look into this further.
And we also want to be the kind of hospital and medical center that other medical centers want to be like. and that they'll follow suit. And as we get really good at doing this within our facility, that they'll want to do it too.
Yeah, the quality care, the quality management, the whole nine yards.
Yeah.
One last question as we narrow down to the last of the questions here on the podcast. Why is it so important for a patient who has asthma to get flu shots or the yearly type of shots? Why is it important?
Well, because if you get the flu and you already have underlying respiratory diseases, you are going to be sicker than a lot of people will be. As for instance, when we had COVID going on, people who had COPD and asthma or any kind of lung disorder, they took it really hard, and it was very difficult to take care of them. And so don't be sick, don't get the flu, take care of yourself, and you can manage your asthma and your COPD or any kind of lung problem better if you're feeling good. Don't be afraid of a shot.
Don't be afraid of the flu vaccine or the pneumovax, which is
No.
the pneumonia vaccine.
Right.
What studies or research, or where could you guide somebody to go online and look up asthma care, COPD, or learn more? What site?
So you can always go to the American Lung Association site. They have an abundance of information on their website, not just for asthma, but for COPD, interstitial lung diseases. You know, there's videos on there for parents that have children at home that have asthma and explaining to them, what do I need to watch for? What medicine do my children need to take today? Like, their website just has so much information for healthcare providers and people out in the community.
Right, tons of great doctors, nurses, respiratory therapists, people who specialize in breathing disorders. They have all kinds of videos on
With the American Lung
Yes.
Association. Way to go.
And there's others too. Just peruse the web and take a look.
Absolutely.
Thank you for listening. Stay tuned for our next episode of Beyond Hospital Doors. To learn more about Sidney Regional Medical Center and services offered, visit us at sydneyrmc.com or visit us on our Facebook page, or you may call us at 308-254-5825. Thank you for your time, and thank you for your continued support. This is Kimberly Dreyer.